After taking the impression, we have to cover the prepared teeth by a provisional restoration. It means a temporary crown or a bridge used to cover the prepared teeth, the abutment teeth, while the prosthesis is finished. In this period, that can be a week or 2 weeks, the prepared teeth are covered by the temporary restoration. The temporary restoration can be made by a material that easily constructed, and the good or strong mechanical properties are not needed because it is a temporary material used for a week or 2 weeks. But the temporary crown give a large number of advantages, that it will protect the prepared tooth against biological irritation such as food or saliva, thermal isolation, and chemical isolation, protect the open dentinal tubules from irritation by acids, prevent the position change and tilting of the tooth because it will lose the contact with adjacent teeth and opposing teeth. Sometimes when the tooth is missing the contact with the opposing teeth in occlusion, may it go with over eruption and be longer. It gives mechanical support. Sometimes the tooth have large filling. After preparation, the filling may fracture, or the tooth itself may fracture because of the weakening of the preparation. So it provides mechanical support. In preparation of anterior teeth, the shape and the aesthetic of anterior teeth will be not acceptable if it is not covered by a provisional or temporary restoration, and the protect dental tubules also from bacterial invasion. The requirements of the provisional restoration is that divided into biological, mechanical, and aesthetic. The biological is to protect the pulp, maintain the periodontium also, the occlusion and the tooth position, and to protect the tooth against fracture. Mechanically, it should resist the function and load within this week or 2 weeks, resist the removal, and must maintain the inter-abutment alignment, prevent the tilting of the abutment. Aesthetically, should have aesthetically acceptable color and good contour and translucency and color stability in order to mimic the anterior teeth. The materials used for temporary crown. The temporary crowns may be direct or indirect. The temporary crowns may be the temporary crowns are divided mainly into ready-made and custom-made. The ready-made, it means it is preformed, such as like these crowns, preformed and ready to be adjusted gingivally and placed over the prepared tooth. The material are, this is called the cellulose acetate, this is called polycarbonate, these are metallic, maybe aluminum, and maybe tin, maybe stainless steel. The metal may be non-anatomic, like these cylinders. Maybe anatomic, it means that it has tooth anatomy. The need for a temporary bridge is needed when we have a prolonged treatment time, a long span, we have excessive lateral forces, we have strong masticatory function, and we have a history of a breakage. It means when the patient have occlusal load and a previous fracture is seen in the temporary bridge, so a good or high strength temporary bridge must be done. The custom-made restoration, it means that the restoration or the temporary crown is made especially for this tooth and especially for this case. This can be made on the patient mouth, that means direct, or made and constructed on the working cast, that it means the indirect restoration. The direct restoration is constructed in the patient mouth. We take impression before preparation, remove the excess, and after preparation we place a separating medium on the tooth, and we mix the temporary restoration material. The custom-made temporary restoration is made from acrylic, polymethyl methacrylate material. Mainly it is a white acrylic, or maybe in shades to mimic the anterior and mimic the color of teeth. And when the mix of the acrylic reach the doughy stage, we can be placed on the impression and attached to prepared tooth to construct the temporary restoration, that it can be finished, polished, and cemented on the prepared teeth using temporary cementation material, which is zinc oxide eugenol impression material. This direct procedure have disadvantages. It use long-term time. It means that all the time that material set and the preparation and the construction of the temporary restoration, all that time the patient is sitting on the chair time in the clinic and take a large time, and discomfort and tiredness of the patient may be seen. Also, it subjects dental pulp to the heat of the acrylic when it is set, and chemical irritation of monomer found in acrylic when it is set. So these two agents may do irritation for dental pulp. And dimensional stages can be seen because we remove the temporary crown in the rubbery stage from patient mouth because of the heat. It is removed from the patient mouth and complete the setting in the impression material, so dimensional changes can be done and distortion may be seen, so unfitness in the restoration. To avoid these disadvantages, we can do the temporary restoration on the working cast. It means we give appointment for the patient for the next day for 24 hours and construct the temporary restoration on the working cast. There is no contact of monomer and no heat and irritation to the dental pulp. And marginal fitness will be better. The cast will be stored in the clinic if in case of replacement and fracture of the temporary restoration. It can be redone easily. These were the advantages of the indirect procedure. The procedure also is summarized by taking the impression before preparation. After preparation, we take the impression and pour. We take two impression poured and sent to the laboratory, and impression from which the master cast is constructed and on which the temporary bridge can be placed. Sometimes we use this type of template to give the outer form of the restoration that made by special vacuum devices, to give the outer form that will be filled with acrylic and from which construction of temporary restoration can be done. The temporary restoration from acrylic is finished and polished and placed on the prepared teeth using the temporary cementation material. The temporary cementation material is zinc oxide agenol because the agenol have sedative effect to the pulp and mechanically acceptable, have moderate strength and moderate mechanical properties that it can be removed easily in the insertion visit. These were the impression technique and the construction of temporary restoration and the end of the first clinical stage in construction of the bridge. After that, the laboratory stage will take a few days for construction of the restoration. And after the construction, the second clinical stage will be done in a clinic by the drying and the cementation of the restoration. Thank you, dear dental students, and goodbye.